It looks like all of the above, which and in order would include how to collect data for MAPP 2.0, what's different, how to start, and how to engage our partners. So thank you for letting us know why you've joined us today. And I am very excited that I have the opportunity to introduce my colleague and Metopio's Community Health Director, Sarah Vanausdall, who has led over 50 community assessments for health systems and collaboratives in Wisconsin and now across the country. She's steeped in the MAPP 2.0 process and it uses her experience to work across organizations and community partners to gather both qualitative and quantitative data to produce high quality survey instruments, facilitate prioritization and design programs and evaluation for implementation plans. She is driven to address health disparities and inequities in communities with data and information as a guide to effectively create and deploy human capital and resources for maximum impact. Sarah is a graduate of the University of Minnesota and also has her Master's of Healthcare Administration from The Ohio State University. So with that, I'm going to launch her slides and hand it over to Sarah, who has a great presentation for you here today.
Awesome. Thank you, Angie. So just to kind of quickly go through the webinar objectives for today, we have the first objective is I'll just give a kind of brief overview of the MAPP 2.0 process, kind of go through how you can leverage the updated process for a better community health assessment, and then also some examples of how health systems and health departments have collaborated and used MAPP 2.0 in a way that makes sense for their communities and the resources that they have. So moving on to the next slide, I just have a brief overview of the MAPP 2.0 process. So MAPP stands for Mobilizing for Action Through Planning and Partnerships. MAPP 2.0 is the updated framework for community health improvement developed by the National Association of County and City Health Officials. And then this graphic on the right kind of shows an overview of the 3 phases. So building the community health improvement foundation, telling the community story, that's really the community health assessment, and then continuously improving the community. So your community health improvement plan, monitoring, evaluation, and impact. So some of the really key steps of MAPP include, developing a community-wide vision for health, involving organizations across sectors, assessing community needs and then strengths as well, and then also assigning resources to address the underlying drivers of inequity. And then you can see at the top of that image, really the overarching goal is to achieve health equity in your community. Getting into the next slide, we have that shows the 9 kind of MAPP 2.0 objectives. They're probably things your organization is already doing in some capacity, but the MAPP framework can really provide some best practices for how to achieve these different objectives. I won't go through all of them, but just a couple that I want to highlight are, for the first one, continuous. So I know that the big, component of MAPP is the community health assessment, but really a good community health assessment shouldn't be just something that you do once every 3 years or 5 years to meet requirements. It should really be about continuous learning and improvements for your community. So that's a very key component of this. Also, I want to highlight flexibility. If anyone's been to the NACCHO MAPP 2.0 training, you walk away with a binder about this thick of all the materials and resources and steps, and it can be a little intimidating for health departments that maybe are smaller, or health systems that only have a few people doing all the community health assessments for a lot of different hospitals. So I really like that MAPP 2.0 is flexible, and you can kind of tailor any of the phases or steps to meet what resources your community has or organization has. And then obviously, kind of going back to the guiding questions of why you're doing each step to make sure you're still, achieving the goals in the way that makes sense for your organization. And then I also wanted to just note community power. the community health assessment component and your action steps should really be centered around community voice and doing what matters to community members. And that can be a little bit of a shift for some organizations. And then I just want to note too, collaboration and trusted relationships. So you're going to be involving community partners a lot. So it's really important that you build those relationships as soon as possible. So it doesn't just seem like you're coming in, asking them for feedback, and then, you'll never see them again. The next slide is some questions kind of still going around the objectives of MAPP 2.0, but these are 4 kind of key characteristics of MAPP. And it's really important before you start to kind of note where your organization is at in all of these processes. And I kind of think of the 4 questions not necessarily as like a yes or a no. It can be kind of more of a continuum and something that you kind of can continuously improve upon. So just the 4 questions: is health equity part of our vision? Are we interested in partnering with organizations across sectors? Are we committed to authentic community engagement? And can we dedicate the necessary time? So with that, I think Angie is going to launch us into a poll.
Yeah, I'm going to share a poll because I think, as Sarah said, everybody is at a different place in their journey, especially as MAPP 2.0 is new. So as I get my hands on this, we're curious about where you are in your journey, which one of these resonates most with you. So if just real quick, maybe tell us where you are in terms of, have you integrated health equity already into your vision? Is that something that is already done? Are you really looking to increase the diversity of organizations that you partner with, knowing that these are systemic and structural problems? Do you need to spend more or want to spend more time on the qualitative data for community voice? And is this staff time or resources, or what else? You can put that in the chat. So I'll share this in just 1 second, get your answers in there. And Sarah, I'll share this with you and you can continue on.
Awesome. Great. Yes, very excited to see. So I see the biggest one is spending more time on qualitative data. So that's awesome. And just to note as well, don't be discouraged if you're not far along in any of these processes. Just kind of circling back to kind of the key components of MAPP 2.0 is really the adaptability. So if you're not ready to take on the full MAPP 2.0 process, you can begin to adapt some of the components and just kind of know what your community is ready for. So very nice. And then I will go on to the next slide that kind of shows the key phases of MAPP 2.0. Like I had mentioned, for today, we'll really be focusing kind of on the assessment side, so phase 2, but just to give a high level of phase 1, building the community health improvement foundation. So like I mentioned, it's really the planning for your community health assessment. So beginning to gather information on current and potential partners, really focusing on who isn't at the table but should be. And then step 2 or phase 2 is telling the community story. So really engaging community members, capturing that community voice through qualitative data and also quantitative data as well. And then phase 3 is continuously improving the community. So your action plan, your community health improvement plan, measurement, and evaluation as well. So for the rest of my slides, I'll be focusing on those 3 assessments on the bottom right of this slide. So for the community status assessment, so this is any of your quantitative data or numbers, stats, and this can be primary, meaning you collect it yourself, usually through a community survey that your organization or a collaborative conducts, or it can be from secondary data sources. So any of those publicly available American Community Survey data, census data, CDC, or county health rankings are some of the common secondary data that is available. All of these publicly available sources are already available in Metopio, so that's been a really great strength for our community health assessments, because you can kind of go through, the list of hundreds of indicators and select what is important to note for your community in terms of health behaviors, morbidity, mortality, social and economic factors. And then also, if you are going to supplement that with a community survey, it really can be quite a bit shorter because you already know what's going to be available on the secondary data side of things. So on this slide, there's just kind of a brief example of some of the quantitative data that can be pulled from Metopio. I know it's kind of small, but it's just meant to be shown as an example. So you can kind of go through the list of indicators and select what you want. This is a housing example. So we selected things like eviction rate, crowded housing, severely rent burdened, and then those can all be automatically generated into a table with any state and national comparisons that you want, or zip codes or anything like that. And that can all be organized into one table. And then with any of those indicators that you want more information on, you can create them, turn them into a chart, a map, or a graph. So there's an example map just kind of on the far right of the slide. And one thing that's really exciting too is we have AI generated descriptions. So once you have your map, you can get kind of all of the, why is this data indicator important? How is the rate trending over time? How does this compare? If you have a map like this, an automatic description of what zip codes or census tracts are highest or lowest, that can all be ready. And then any of these images, tables, descriptions are all kind of ready to go and include into your community health assessment. And with that, I will move to the community context assessment. So this is your qualitative data or stories from community members, community leaders. And again, this can be primary or secondary. And we really like to focus on this at Metopio because it kind of gives a voice and the lived experience context to any of your data points. These methods can be focus groups, photo voice, interviews, town halls, or asset mapping. It is really helpful. We can actually start, this qualitative data collection really early in the process because we already know what quantitative data is available. So if we can start with the qualitative data collection earlier, we can really center our community health assessments around community voice and truly listen to what is important to the community, and that can kind of guide the rest of our process. So that's been really helpful going forward. Another thing that's pretty exciting, using Metopio, we can do qualitative data analysis. So you take any of your transcripts from any of your interviews or focus groups, and you can upload them into Metopio and get automatic summaries generated. And then that can generate kind of and identify, common themes and patterns. So really you can begin to identify your top health issues early and identify what are the root causes as well. And then it also will take any important quotes from your transcripts and organize them based on the health issue. So usually we can do quite a few more focus groups and key informant interviews just because we don't have that burden of analysis. With most of our clients, we typically do about 10 focus groups and 30 key informant interviews. So just this example on the right is the qualitative data analysis on Metopio. So any of the health issues are organized based on number of mentions in all of the transcripts. So if the bubble is larger, that means there were more mentions in all of the focus groups and key informant interviews. And then the quotes are organized by theme at the bottom. And moving on to the next phase, we have the community partner assessment. So that is a survey for community partners to identify what are the capacities, skills, and strengths that each organization can bring to the community health improvement process. Really, you can avoid a lot of duplication, reduce enhance collaboration, and then also leverage collective impact and really address the root causes of a lot of these health issues when you can kind of have that collective impact. Some common challenges. I know if you're familiar with the community partner assessment that's recommended, it's I think about 59 or 60 questions. So that can be a really challenging length to get a large number of community partners to fill out that entire survey, especially if you're going to be asking them to do other things. So we have had some clients that want to do the full survey. It's also completely acceptable to kind of shorten it to meet the needs of your community. And I would just recommend really, focusing on the questions related to strengths and skills, and then gaps in the community to kind of shorten it down quite a bit and make it a little bit more feasible to get a large number of individuals participating in that. It's also helpful to kind of encourage participation to really orient any partners to the process. They definitely don't need to be experts in community health improvement or MAPP 2.0 to be oriented. They really just need to, be aware of the purpose of the data collection. Note that, kind of this process is, noting, helping to kind of gain, sustainable solutions to community health issues. And then also emphasize, how will this help their organization? So it's not just for you, but it's also for the community partners. And that's kind of where that continued relationship comes in as well. And then just on the screen here on the right, we just have an example of some, kind of key findings just to kind of note the strengths of this. A majority of the organizations, so in this example, 72 or 3 organizations were surveyed, and the majority of them were addressing mental health and behavioral health. So that's really a huge opportunity to kind of leverage that collective impact and, align priorities. There were also some gaps around, mapping, visualization, and asset mapping. So that's a huge benefit to having, a dashboard available to the community as well, and kind of making that known that resource is available in the community. And then just kind of for the continued participation, for this particular example, we presented the findings at a prioritization meeting, so we didn't call all of the community partners back for a separate meeting just to kind of go through the community partner assessment. So that was a way to kind of save time as well. Then moving on to the last slide, I just have a note about, maximizing MAPP 2.0 collaboration. So this is an example from the Allen County, Ohio Health Atlas. So just a good example from health departments and health systems collaborating on data collection. It can be really successful to have these collaboratives have a shared survey, so you're not surveying community members multiple times, and then break out results. If you do have a hospital service area, you can kind of break out results based on what zip codes your hospital wants to look at, or what area your health department wants to look at. We've also had a lot of success on shared timelines, so kind of all aligning around a 3-year timeline, and then also community engagement. So if you're going to be bringing community partners together, it can help to kind of have kind of shared, engagement, and not be repeatedly asking, community partners to come together multiple times for the same purpose. And then really, once you get the, kind of key points, data summaries, all of these can be, adapted to meet the unique needs for community health assessments for different organizations. And I see Angie popped on. I think there might have been a question.
Yeah, somebody asked, is the Allen County Health Atlas on Metopio?
Yes, correct. It is through Metopio.
So the Atlas is a forward-facing component instead of having a static dashboard or a PDF report on your site. A lot of our clients who have worked collaboratively between the public health department and the health system find this as a resource that benefits both sides. The health department no longer has to give the health department data every time they need it on different cycles. They can just go and share a common set of data through the atlas. And then the public, this also goes to data equity and data literacy among your partners. I think Sarah was just talking about the community partner assessment, and a lot of those folks have no data staff or have no access to this data. And really, they're trying to bring resources to your community to try and help you achieve your community health goals. And so by sharing this, you often give people with lived experience who don't have access to data the data to advocate for themselves, and you build data literacy within your partners so they can use this to go put in grant applications or to do reports for their boards and things like that. So it's been a really good way to see the kind of that continuous process coming out of the community health assessment and going in to the community health improvement process be continuous. So and to that point, we have a couple more questions, but I would like to launch one more poll if you all are willing about, MAPP has really given us the flexibility to look at how should we order these and how do we need to be responsive to our community to fill gaps. And once you complete it, then you move into your community health improvement plan. And we're developing a process within Metopio for that as well. And really curious about what you find to be the most challenging part, or what about the chip is the most stressful part. And if you want to give us some insights to that while we ask a couple more questions, I think what we're trying to do is figure out how we leverage all the data you've brought together and put it directly into your chip. So a couple more questions, Sarah. Does MAPP have any guidelines about sharing the CHA with your partner or the community?
Yes, I believe so. And do you mean sharing the actual, do you mean having a combined report or sharing it, like making it publicly available?
I think making it publicly available. I think that was the question.
Yep. Yes, there are specific steps within, like if you go to the NACCHO, MAPP 2.0 handbook, a specific step around, sharing your community health assessment, making it available. I think there are some good kind of tie-ins to, I know I've learned about, the tie-in to health equity as well, and making it accessible, but you really shouldn't be publishing, some 200-page document with no summaries at all and only available in English. So, based on the MAPP 2.0 guidelines, they recommend, if you do have a report, have some type of, executive summary available. If it's at all possible, have it available in multiple languages, kind of things like that to be aware of. So yeah, there is specific guidance around making your community health assessment available to the public. And then IRS guidelines as well for hospitals.
Right. So I have another question. I'll close out the poll. We'll talk a little bit about CHIP, but this is a really interesting one. So what is a good place to start if our hospital hasn't really worked very closely with our public health department yet? They're on a different cycle.
Yeah, that's a great question. So I've worked with some of those, not on the same cycle, getting on the same cycle. So one example that I can think of, we aligned around a common timeline for, a community survey, interviews, kind of that, just the data collection component to start with, even though we were at slightly different schedules and maybe publishing at slightly different times, but we were still able to align around data collection. So kind of just taking those incremental approaches, collaboratively, developing the survey, selecting kind of key stakeholders, things like that. So I would say kind of emphasizing just the incremental, improvements. It doesn't need to be everything changed all at once.
So I'm going to end the poll and share the results about the CHIP challenges. We have a couple more questions, so keep them coming, everyone. So let's do CHIP challenges first. So it looks like prioritizing to maximize impact and measuring impact, followed closely with partnering with the right organizations, mapping and writing. So I know that measuring impact and translating those priorities from your CHA into your CHIP is definitely something, a direction that Metopio is going in. So that's very exciting. A question we have here is, can you talk a little bit about how qualitative data is analyzed by subpopulation. With your tool, you showed a bunch of transcripts. So are there ways to do that? And if we have time constraints, how can we do more?
Yeah, that's a great question. And I think Angie and I, we were actually talking about this morning. So I really like that one, kind of feature in the qualitative data analysis is you could, potentially upload, say you do 3 focus groups, related to youth and you want to just upload and analyze those. That could definitely be an option going forward. And then, maybe you do adult and senior health and want to run those separately, and you could kind of compare, what are the key themes that are coming out and how are they different based on different populations. So that could be a really good example of a way to do that through qualitative data. And again, I think there was kind of a second question wrapped in there of, how do you do more interviews and focus groups if you don't have the time? I'm not saying you necessarily have to do, those 10 focus groups and 30 interviews, but just really being kind of intentional about who you're inviting to your focus groups and who you're interviewing based on, your priority populations and who you really want to hear from.
Thank you. So we have one last question about, let's see, working with the order that you do the assessments. So I'm trying to decipher this one. So you talked about the 3 different assessments and they didn't go in the same order as was shown on the slide. Is that for a reason?
Yes, Angie and I were playing around with this a little bit. I originally had context first. We wanted to start with the community status assessment for the presentation, just because that's kind of the traditional way of how people, they started pulling their, publicly available data, cleaning it, curating. And so that's why we started with this one. But typically, when we lead the process, we kind of do more of the community status assessment and community partner assessment first, just so you can really have that community voice at the center. But it is, it's different based on the community. And that's one great thing about MAPP is you can kind of have a lot of overlap, or you can do the steps in the process that works for you.
Okay, we'll sneak one last one in before we let everybody go. Can we still do the MAPP 2.0 process if we haven't done the partner assessment?
You technically wouldn't do like the full, MAPP 2.0 process without the community partner assessment, but you could definitely do the other components for sure. Yeah, you can pick and choose if you just want to adapt or adopt certain components, definitely.
Great. Well, I know that MAPP 2.0, as you said, there's a big binder out there. We will be sharing the slides, and the link to the NACCHO toolkit is included in there. We highly recommend that you use all the resources that they've been developing and guiding and talking to health departments across the country. And I will also say that we are going to continue talking about MAPP and the evolution of this, how you dig in more into survey work, as well as the CHIP process. So if you're interested, our next webinar will be on the CHIP. So I have that poll. If you're interested in joining that next webinar, you can let us know. And also, we had a question about whether or not Metopio is a subscription service. And it is. Our platform was built, Metopio, just for what it's worth, Metopio was built from folks who were working in community health and saw the opportunity to shift the expertise from the data, kind of the data curation that everybody was doing over and over again, to community voice. And so Metopio does have a platform that helps you do your community health assessments and take community context into decision-making far beyond that work. We see folks who are working with us that we can elevate the CHA and CHNA work throughout your organizations and make it more enjoyable, get you back to the work that you love in the community. So with that, I just want to thank Sarah for sharing her expertise and being part of the Metopio team. And I will let you all enjoy the rest of your day. Thanks so much for joining us, and we'll see you next time.
Thank you.